When a child comes here crawling or he's unable to walk and we treat him and rehabilitate him, to see him walk for the first time in his life is just an absolutely amazing feeling. I realized that I could really make a difference to people who were far, far worse off than I was. When you are helping people, when you serve, when you give, the satisfaction that you get, it's incomparable, you know. HRDC was established by Dr. Ashok Banskota with a vision of making state-of-the-art world-class care available for physically underprivileged children of Nepal. Well, after I returned from my training in America a long time back, healthcare system in Nepal at the time was, very, very meager. The enormous challenges that existed and the total lack of organized care, especially for children, was very alarming. And how just a little bit of kind, compassionate care and little bit of skill applied to a problem could achieve such a profound change in patients. I used to just imagine my own children's faces, when I saw these patients, and that further made me realize that there was so much to do out here and be a change maker. My father used to work 7 days a week. So on weekends, he used to take us to the hospital. And I think that had a very deep impression on us, because now when I reflect on my experiences as a child, I can fully understand that that must have triggered this love for this place that I feel. I always say, for me, when I start climbing this hill, it's not like going to work, it's like coming home. My father is really my inspiration, and we grew up seeing him start and grow this work in spite of a lot of odds and hardships. Mahatma Gandhi said, the smallest good deed is better than the biggest good intention. And I think my father is an epitome of that. If he had waited for things to be ideal, it would have never been. So he just saw a child and decided to start with one child and treat that child, and it just went on and on and on. And it's 38 years later, we have this beautiful sprawling institution that goes to the length and breadth of Nepal, scouting these children and bringing them here for treatment. Our mobile clinic networks are perhaps the most important part of our model of delivery, because they allow us to get to these children who are hidden in remote villages and who don't necessarily have the capacity to turn up at this hospital. The solution to this is to go to them yourself, and that is how the mobile clinic network was conceived. HRDC's mobile clinic network sees almost 55 to 60% of our total consultations. So these are an integral part of this hospital if we are to reach the most impoverished areas of the country and to reach the children who are in most need of our services.
We look for disabled children in various communities. We go to schools and communities to sensitize the children and adults about disability. We also do home visits, during which we find disabled children.
There are four main barriers to why a child cannot participate in society. They are poverty, lack of education, any form of disability, and unfortunately, in our type of environment, female gender. And many of the children that come to HRDC have all four of them, the female children, or three of them. By intervening in disability, you can empower them to address the other barriers. For example, a child who could not walk before, if you make them walk, they can go to school. If they go to school, they will address the other barrier, they will get an education. If they get an education, they'll earn a livelihood, And if they earn a livelihood, they will be, instead of, as opposed to their family supporting them, they will be supporting their family and they will start contributing to society. And eventually their example will also help change social stigma and gender biases, So all of these interplay with each other. We specialize in treating disability, but like I said, when you treat a child's disability, it is not straightening the bones, it's straightening the being, the human being, And then you see the parents. You are converting a hopeless situation into a very hopeful situation. You are giving them dignity.
Earlier, I couldn't walk straight due to my condition. I had to walk on all four limbs. I would be alone at home. I couldn't attend school nor go around with my friends. After my treatment, I could now walk around and look at people straight. I am now able to hang around with my friends and also attend school like others. I am very happy now.
Reflecting back for over 4 or 5 decades of professional life, I think I have made the best decision and I am a extremely satisfied, individual. And I thank everybody who has pitched in and helped us out to come this far.
I think the future of HRDC is very, very bright. My father started this hospital 38 years ago. He was one doctor and he had 35 staff. Now we are more than 30 of us, doctors specialized in various streams of children's orthopedics. The program has expanded to various parts of the country. Every year, about 150 days of work is done in the field through our mobile clinics.
Well, my dream is kind of realized, There is a young, very professional, competent generation of doctors who are running the show. From one person, it has become a big team and they are very capable. And my dream is that this work just go on and help more and more children.
My dream is that, this kind of service be available to every child who needs it, This is the dream with which my father started this institution in 1985. And we've come a long ways since then. But we know that there are still many, many children who are in need of our services. And I hope a day will come when each one of them can avail of these services and, we can better their lives. So more kids, more service. That's my dream.